and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. Many service members who deployed to Iraq and Afghanistan following 9/11 are left struggling today with debilitating lung and respiratory conditions. Now, the combination of exposure to toxic burn pits, diesel fuel, industrial pollution, and dust clouds has created long-lasting issues for veterans unlike pulmonary experts have ever seen. Dr. Cecile Rose is Medical Director, Center of Excellence on Deployment-Related Lung Disease and Professor, Department of Medicine, Division of Environmental and Occupational Health Sciences at National Jewish Health. She's joining us here to talk about the creation of the Center for Deployment-Related Lung Disease to advance research and better diagnose and treat the very complex range of respiratory illnesses that veterans face. Welcome to Health Professional Radio, Dr. Cecile Rose. Thank you so much for taking the time with us.
My pleasure, and thank you for having me.
What is it that attracted you to this deployment-related lung disease problem with our veterans?
I became involved in the problem of deployment-related lung disease in around 2010 or 2011 when our clinic began getting phone calls from military men and women who were returning from deployment to places like Iraq and Afghanistan who reported having disabling respiratory symptoms that they didn't have before deployment. They began training us, teaching us about the exposures, including exposure to burn pit smoke, desert dust, diesel exhaust, some of the things that you've already mentioned. Mm-hmm. And because we specialize in diseases of the lung that come from hazardous exposures, we realized that we had to focus on this to really be able to help these people who were coming back with these respiratory conditions.
Were there any challenges in establishing the Center for Deployment-Related Lung Disease?
I would say that the major challenge was that particularly at the beginning, there was very little information about respiratory diseases that can occur from these kinds of exposures. So we were in a huge knowledge deficit, and that was what prompted us to pull together a group of medical experts, exposure experts, people in the military as well as people in academia, and people who would bring different kinds of expertise to the problem so that we could try to tackle this in a reasonably well-organized way. But it took time to get that off the ground and to assemble the people we needed to help.
Many veterans struggle with basically just being seen, identified for myriad reasons. How are you recognizing and treating these veterans? How are you identifying them?
Yes, great question. I would say that when we first started doing this, we created the Center for Deployment-Related Lung Disease with the idea that military men and women who had been deployed could call us, schedule an appointment, and undergo a comprehensive evaluation where we would really try to understand their symptoms, mainly shortness of breath and cough, but other symptoms as well related to respiratory diseases, get clarity around what their diagnoses were, and then get treated and helped to try to live with those respiratory symptoms.
So what were some of the struggles in establishing that? I mean, were there struggles with patients being able to contact you? Were there struggles with them not being willing to talk about what was going on with them? And maybe they weren't aware that some of the problems that they were having were related to their deployment.
Well, that's quite true. Particularly 10 years ago when we first became aware of this, there was a tremendous amount of ignorance and lack of knowledge, just huge knowledge gaps about the exposures, about the risks, about the diseases. And over time, our group at National Jewish Health, along with others around the country, started to collect information and study what these veterans were describing and trying to put our heads together to understand it. So we were very privileged, I would say, to have military men and women with these respiratory symptoms who came for clinical evaluation, but who also agreed to participate in our clinical research studies. Mm-hmm. And it was through their participation and through their help that we started to pull together the information, the data, the research that we needed to try to understand their symptoms.
this clinical trial, how was it conducted? Who were the people that were involved? I know you said that they agreed to participate, but what were some of the things that were brought to light as a result of this clinical trial specifically?
I would say that with regard to our clinical research, what we were able to find at the beginning was the spectrum of respiratory diseases that could be linked to deployment. And those respiratory diseases include asthma, rhinitis, which is inflammation of the nasal passages, sinusitis, which is inflammation of the sinuses, more uncommon condition called bronchiolitis, which is inflammation of the small airways in the lung. And the challenge of bronchiolitis, which was first described by investigators at Vanderbilt and which we then confirmed and have published with help from our participating military veterans. The problem with bronchiolitis is that it's very hard to diagnose with standard diagnostic tools. So if you just do a simple breathing test, it will probably be normal, particularly because veterans typically start out with high normal lung function. These are people who have to pass military physical fitness and physical readiness tests. So they probably start out with very high lung function, and we don't know what their baseline is before they go to adverse environments in places like Iraq and Afghanistan. They come back, and their breathing test may be normal. You have to develop much more sensitive tools to understand the bronchiolitis or the inflammation of the small airways. And so the people who worked with us helped develop a test called the Lung Clearance Index test, which showed that military veterans with respiratory symptoms were abnormal. They were much more abnormal than people who had not been deployed.
Is there anything you'd like to add as far as the future of research in this area to find the best options for veterans who may be struggling with some of the lung symptoms and that you've discussed?
I would say that there are really two issues there. One is the need for ongoing research. We do not understand how many people were affected. We don't know what the prognosis is. We don't really know whether people remain stable or get worse or maybe improve. So there's a great deal of research that needs to be done to try to answer those important questions so that veterans know what to expect for the future. We are also interested in developing tests to try to treat these conditions because many of the tools we have just simply don't work. So the research side of this is really important. But I would also say that veterans need to know about the PACT Act, which is the act that was signed into law in August of 2022 by Congress, which expands the healthcare eligibility to several groups of veterans who were maybe not eligible before, but who have been exposed to toxic substances like burn pits and sandstorms and explosive blasts.
Well, Doctor, if you would, give us a website where our listeners can learn more.
I would recommend that your listeners go first to the nationaljewishhealth.org website and then follow the instructions to get to the Center for Deployment-Related Lung Disease at National Jewish Health. We have a great deal of information there. And of course, I also think that people who want to know about their eligibility for the PACT Act can go to va.gov/PACT and get more information about these respiratory conditions. There are over 20 presumptive conditions that are covered by the PACT Act, including 11 respiratory conditions. And people need to find out whether they may be eligible for those benefits.
Doctor, it's been a pleasure speaking with you. I appreciate your time here on Health Professional Radio. Thank you so much.
I really appreciate your interest. It was my pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Cecile Rose. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.